Hello, everyone. Welcome to CCI's webinar, CNOR Certification, Pathway to Excellence. I appreciate everyone being on tonight, looking at your continued professional development and certification as part of your New Year's resolutions. Let's go ahead and get started. A couple of housekeeping details. I'll be answering questions throughout the webinar and again at the end, so please don't be shy about writing your questions into the chat feature, which you will find in the lower right-hand corner of your screen. If you need additional information or support, please don't hesitate to call our credentialing specialists or email us at info@cc-institute.org, and I'll have that contact information again at the end of the presentation. I'm required to provide this disclaimer in any of our presentations. There's no requirement to purchase anything from CCI in order to prepare for the exam, and purchasing anything from us does not necessarily imply successful performance on our examinations. I'll be talking about some things that you can purchase from CCI in terms of study materials tonight, but my purpose tonight is not to sell you anything. My purpose tonight is to help you get prepared to sit for your exam. So that's my goal for tonight, is to help you feel comfortable at the end, answer your questions, and get you excited about certification. My name is Julie Maurer. I'm the Nurse Manager for Education Development here at CCI, and this is one of my favorite things to do, is to talk with you and provide you information about certification. Here's our objectives. We are going to review the eligibility requirements for CNOR certification. We're going to look at what's on the CNOR exam, and I'm telling you straight up, I'm not giving away any secrets. Everything I tell you tonight is public knowledge, and most of it you can access through our website, and I'll show you how to get to that information during this webinar. We're going to look at some successful study strategies. We're going to answer just some sample multiple choice questions just to help you get familiar with that process. And then we're going to look at applying for the exam. Certification is defined as the documented validation of professional achievement of some identified standards as demonstrated by a perioperative nurse. I think that all of us like to think that we are good nurses, that we take good care of our patients, that we are an optimal team player, that we're looking for good patient outcomes, but having RN behind your name designates that you have a generalist competence. CNOR means that you have specialized in perioperative nursing and then have met some standards that say that you've gone above and beyond that generalist capacity that licensure shows. Our eligibility criteria are that you have to be licensed as an RN in the country or the state where you're currently practicing. The CNOR is an international credential. We have nurses all over the country and all over the world who hold this credential. You need to have completed a minimum of 2 years and 2,400 hours of perioperative nursing in one of 4 roles. Most people with 2 years of experience are taking care of patients. There are direct care providers. They're in the trenches. They're providing direct patient care. But we also recognize administrative, teaching, and research roles as eligible to sit for the CNOR exam. At least half of those 2,400 hours have to be in the intraoperative setting in terms of providing support or care for the patient during that part of the perioperative continuum. This does not mean that you have to be providing hands-on patient care. Let's look at a couple of examples of other roles that would still be eligible to sit for the CNOR. Let's look at our managers, our directors, our supervisors who are no longer in the OR, but they are many times hiring people or have direct hires under them who are providing that care. These people are eligible for the CNOR exam. Let's say you're working in IT and you are orienting new staff to your electronic health record, you're orienting staff to updates, and part of that orientation involves the perioperative record. These people are eligible to sit for the exam. But please understand, again, that most people are caring for patients in that 2-year experience requirement, and most of the questions on the exam are based on that type of care. So if you haven't been in the OR for a while, you may want to dust off those brain cells and refresh some of those direct patient care responsibilities. You also have to be currently working either full or part-time in a perioperative nursing role. And we do not specify what part-time looks like. It may be, you know, taking call one weekend a month or giving lunch reliefs, whatever that might be. But if we called your supervisor, they would need to say that you are participating in a perioperative role to have you be eligible. Okay, the exam consists of 200 multiple choice questions. It is timed. There are you're given 3 hours and 45 minutes to complete the test, and this can be a little anxiety provoking for some people. But we're going to go through some sample questions, and I'm actually going to time you. And most of the time, a minute is plenty of time to answer a question. And if you can answer questions consistently in a minute or less, you'll have plenty of time to finish the exam in that 3 hour, 45-minute window, and also have time to go back and check your answers. The exam is updated annually to reflect current perioperative guidelines. I just yesterday got my 2021 AORN standards. And what we do, our test item development review people will go through the standards, go through our questions, and make sure that nothing has changed to make sure that our exam is reflecting those current best practices. This obviously takes us some time, so the 2021 standards will not show up on the CNOR exam until July 1st. So if you're using your 2020 standards to study from right now and plan to test before July 1st, you're fine. Okay, let's look at some resources. This information, again, is on our website. This is a breakdown of what's on the exam and the percentage of questions. We did a job analysis in 2019. So if you've got some really old information that you're studying from, this may look a little bit differently. We went from 9 subject areas to 7, for instance. We tweaked the percentage of questions to reflect, again, current best practice, which changes. And this job analysis is conducted by your peers. Your people working in the OR determine what is on this exam. It's not CCI, it's not me, it's the people who are doing the work. So let's look at this a little bit, because this is a great way to organize your studying. The first subject area is pre and post-operative patient assessment and diagnosis, and the percentage of questions is 15%. The next one, individual plan of care, is 8%. The really heavy hitter is our management of intraoperative activities. And this is what people tend to be most comfortable with who are providing direct patient care, because this is what they do every day. And that's 34% in the exam. Over a third of the exam is intraoperatively focused. Communication and documentation is 11%. Infection prevention and control includes both instrument processing and things like standard and transmission-based precautions, HVAC parameters, all those kinds of things. So again, this is a big, big, big domain, and a lot of people are not real comfortable with instrument processing. So if I'm describing you, this might be an area where you'd like to spend a little bit of extra time. And we'll talk about different ways that you can do that. Emergencies 10%, professional accountabilities is 6%. We talked about 200 questions on the exam. 185 of those are scored. The only way we can know if a question is performing the way we want it to is to have people take it. So 15 questions on the exam, and there's no way for you to know what those questions are not scored. You do not get credit if you get them right. They don't count against you if you get them wrong. So just so you know that there will be some questions on the exam that we're trialing basically to see how they perform, what kind of legs they have, and put them then on future exams. Here are the recommended textbooks, and you certainly don't have to spend all of your study time reading, but a lot of people want to get that little bit of extra information that their practice doesn't provide them. Your practice may be very specialized. You may be only doing hearts. You may be working in an ambulatory surgery center where you're doing ENT and eyes. You may be working in a VA hospital, and most of your patients are elderly and male. So look at your practice and then look at what resources you need. The first book that we recommend is the current edition of AORN's Guidelines for Perioperative Practice. You purchase this book from AORN, not from us. And again, we talked about the 2020 edition is fine until July 1st. This book helps us guide our practice. It provides guidelines, recommendations, standards that are considered best practice at this time. About 25% of the guidelines are updated every year. And if you look in the table of contents, it'll say new, and that means that those guidelines have been reviewed. So when people ask me, well, can I use an edition that's a couple years old? Well, I guess it's better than nothing, but again, you've got potentially half of that book has been updated. So I always recommend that people get the absolute most current edition in order to study. Studying outdated information is not going to help you. There are a couple of other reference books that we recommend. You do not need to purchase all of these. You may find these on Amazon. Amazon has a feature where you can rent the book for 3 months and then turn it back in. You can purchase the book and then sell it back. You might want to check with your manager or your educator to see if these books are available. They're not inexpensive, but every department should have at least a couple of these available. Alexander's Care of the Patient in Surgery has been around for a long time, and you may have a pretty old copy in your department. So make sure that you've got the most current one, which is a 2019 edition. This book and Berry and Cohn's do a really nice job with describing different specialties and talking about the equipment, supplies, things that you need to get ready for your case. Odom Horan's book, Peri-Anesthesia Nursing, does a really nice job with the pre and post-op piece of our perioperative continuum. And this is actually a new addition to our recommended texts. It will not go into the detail that Alexander's or Berry and Cohn's does in the specialty procedures, but it does do a better job of discussing pre and post-op care of the patient. So it's up to you. Look at when you look at Amazon, you can do the search inside function with these books and see what they're like and pick out the one that's best meets your needs. Okay, there's some other references. A lot of our patients are having surgery because there is something wrong with them. There's some disease process going on. So a good pathophysiology textbook is not a bad idea to have access to. If you have a hospital library, some of these books may be available. That's another place to check. Or if you're going back to school, many of the times those libraries will have some really good resources as well. A medical dictionary, Taber's, is pretty much the gold standard there. If you don't understand what a word is, it's really a good idea to look it up. You might see that same word in a question on the exam, and then it would be sad to miss a question because you didn't understand what that word meant. There are a lot of different lab reference manuals. Your laboratory should have one and should be able to lend it to you to look up some of those values as you need to. You may have a hospital formulary or a PDR on your unit. I recommend Epocrates. This is a free app that you put on your phone, and then you can bring up virtually any drug that you want to know more about. It'll have side effects, dosages, adverse effects, black box warnings, just about everything you need to know about that drug. I know that I hear people say, I don't give those meds. Why should I know what they are? Well, that may be true, but sometimes they will have reactions with the meds you are giving, for one thing. It gives you a really good sense of what comorbidities your patient's bringing with you. If they're on insulin, if they're on a beta blocker, if they're on antihypertensives, that gives you a clue on how ill your patient is, and some extra things that you may be thinking about in designing your plan of care for that patient. So I always recommend that people understand not only the medications that are given during surgery, but the medications the patient is bringing with them to surgery. If you're a member of AORN, you know that you get the journal every month for free. This is probably worth the price of admission. The journal is a treasure trove of articles about cases and patients that we may never see, but which may be represented on the exam. They also provide more in-depth explanations of the guidelines, which comes in really handy. And I've had people tell me, this is why I passed the exams, because I read the journal every month. If you are not an AORN member, find somebody in your department who is, and see if they will loan you their journals. AAMI standards include a lot of the parameters for our instrument processing. Your SPD should have a copy. ST 79 is the one that you probably want to be looking at. But this is where the AORN gets their information for their guidelines on instrument processing, sterilization, disinfecting, things like that. And then obviously there's a lot of good information on the website. I've just listed a couple of things here, but this is the opportunity for you to expand your current knowledge base. Gives you permission to learn more. The exam is based on what you know, not necessarily what you do. We've got some free resources, and here's our website. We've got a candidate handbook. I highly recommend that you spend a little bit of time and look through that. It has a lot of the information that we're going over tonight. The study plan, which now that I've got my new guidelines, I need to update. That'll be reflecting the new drains and guidelines beginning in July 1st. So, but anyway, this helps you get organized. And we'll show you a little bit more about what that study plan looks like in the next slide. There are just a few sample exam questions on our website, and we've got a couple tonight. But just understand that any sample questions, whether it's our practice exam, our study guide, prep for cert classes, none of those questions will be represented on the exam. And we work really hard to make sure that people who purchase our products are not given an unfair advantage because of that. So any question that you see either tonight or during your prep is not going to be on the exam. Our staff are a wealth of knowledge. We have wonderful people who answer the phones. They're our frontline folks. They can probably answer 97% of the questions about things like eligibility, how much do things cost, what resources are there. If they can't answer your question, then they transfer it back to Dawn and me. So there's always going to be somebody available to help you. And then we do these webinars. These are recorded. So it gives you another avenue for getting familiar with the information. If you've got people in your department who aren't able to attend tonight, know that this is being recorded. If you're an educator, makes for a great in-service. We run for about an hour here. So those are just some ideas of ways to use these webinars. Our prep materials, now these are for sale. We just, I want to say in September, put out our new CNOR exam prep book. So this is based on our new job analysis. There are questions at the end of every chapter, and then another, I believe there's over 100 questions in the back. People tend to enjoy taking the multiple choice questions. Again, you're not going to see them on the actual exam. We have an on-demand prep course. We just are finishing up updating our virtual course, and then we're going to start again doing live courses this year when people can start traveling again. And then we've also got an online practice exam that mimics very closely the actual testing experience that you'll have and gives you a breakdown of how you perform in each of those 7 subject areas. Let me see if anybody's got any questions here before I get too carried away. Nope. Okay, let's look at some test taking strategies. So what we're going to do tonight is look at some ways to get you ready, just like when you're getting ready for a big case. And you don't just walk in at 7:29 for a 7:30 case and expect to be ready, expect to be prepared, expect to be able to do a good job and provide good patient care. The exam is no different. What you need to do is be prepared. And instead of a preference card, you've got those resources that we just got through talking about. It's also a good idea to do a self-assessment. What kinds of cases do you do? How long have you been in the OR? Acknowledge that you might have some opportunities to learn more things, but understand that you're building on what you already know. You don't have to start from scratch. You can look at those subject areas, those 7 domains, to organize your study plan, and you can look at it from a couple of different ways. Some people just start with subject area 1 and go through. You may look at the areas that you're least familiar with, or you may look at the ones that have the highest percentage of questions. So there's all kinds of ways to start your study plan. It's really up to you. Everybody learns differently, and just because somebody else passed the exam and didn't study at all, mean that might not be the best option for you. So look at yourself, look at your study habits, look what you are currently doing in your practice. We recommend that you take 3 months to study. This again is highly variable. Some people take longer, some people take less. The point is to have a goal in mind, set a date, because if you're like me, if you just leave it open-ended, you're going to put it off and put it off and put it off. So look at the next 6 months, 9 months, years, whatever it is, and plot out when is a good time to study and when's a good time to test. When you study. This is really your time. Whatever you need to do to be comfortable with getting this information into your brain. We all like to think that we can multitask and we can do several things at once. What happens when you multitask is, yes, you may do several things at once, but you're not doing any of them as well as if you were doing one thing at a time. So again, this time is for you. If you have to get up half an hour earlier or stay at work a little bit longer, whatever it is, to get that time for you to get prepared. This can look overwhelming, and some of you are already probably a little bit anxious with some of the things that I've gone over so far. You know what? That's normal. Don't try to do this all at once. Don't try to read Alexander's cover to cover over the weekend. It's little bits at a time, and that's why you really need to figure out how much time this is going to take you to study so that you do have that time, but bite-sized chunks, 20 minutes at a time. Count your work as part of your study plan. Reviewing things. The more times you look at something, the more likely you are to remember it. Looking at something once, the chances are really good that you're not going to remember it. So give yourself time to go back and look at things again. Look at broad concepts rather than individual facts and figures. And that's one of the things that I caution people about with the flashcards or practice questions. There's a question about potassium, and that's what people study. They memorize the answer to that question, but on the test, it may not be potassium, it may be calcium or magnesium or sodium. So make sure that you're looking at, what is this question asking me? Is it asking me a question about electrolytes? So I better know a little bit about all the major electrolytes, and not just the values, but what that means from a clinical perspective. What do hyper and hypo look like? How is that going to affect the care that I give my patient? How is my patient going to react to those alterations? So these are some of the things to start thinking about. And one of the reasons why a pathophysiology book is a really good idea, because they'll have these things. Or your lab manual often will have a nice little synopsis of what hyper and hypo in terms of your electrolytes look like. And I'm just using electrolytes as an example. It's not like the entire exams on electrolytes, but it gives you an idea of how to broaden your studying a little bit. And I never have people not do this. I think people sometimes take or spend too much time on practice exams. Once you've memorized the answer, you're not going to improve on that. So actually, the first time you take the test is probably the most accurate reflection of your knowledge base at that time. Let's see if we've got any questions right now. Okay, and thank you everybody for writing questions. People are talking about Prep for Cert classes here and resources. First of all, none of these are a requirement. Prep for Cert, and let me back up a little bit. Any one resource should not be the only thing you use. So if you've taken Prep for Cert classes or online practice exams, that's great, but augment that with your reading from those references we talked about, and or looking at opportunities to actually do those cases in your clinical setting, if possible. We remember best when we do something. Blood gases tend to be a mystery for us. We may get patients who have that as part of their patient record, or we may be sending blood gases to the lab. There are a couple of really good resources. First of all, there's some online resources that provide opportunities they give you the values and then you figure them out, and it gives you immediate feedback on whether you got that right or not. And you can just Google blood gases and it'll come up. The other thing is to use your partners in ICU who do this every day and see if you can get some values without any patient identifiers on them, just the values, and see if you can figure them out. Your anesthesia care providers are also a really good resource on evaluating blood gases. And if you have access to the AORN journal, again, just put in search blood gases, and there's been, I think Brenda Larkin did a really nice article. It's a couple years old on interpreting blood gases. So there's a lot of information out there. Please understand that we are not critical care nurses, and our test does not reflect that. You will see, one or two questions on blood gases, but I would hate for you to miss passing because you missed that question. So yes, thank you for bringing that up. You don't need to devote your life to blood gases, but it's good to understand respiratory metabolic acidosis and alkalosis. Thank you. Thanks for those good questions. Okay. So let's look at analyzing some multiple choice questions. And let's look at what a multiple choice question is made up of. The stem of our questions contains all the information needed to answer that question. And the question may be written in a couple of different forms. It can be either you're filling in the blank at the end, or you are answering the question in response to a closed-ended question. So those are the two, those are what the multiple choice question is made up of. Now let's look at the answers. We have 4 options, only one of which is correct. The other 3 options are called distractors, and that's exactly what they're meant to do, is to distract you so that you are required to know the information to get to the correct answer. There are no true false, no multiple choice, no all of the above, none of the above, A, B, and D are correct. You don't need to calculate anything with a calculator. There's no pictures, no anatomical drawings. So if that makes you feel a little bit better, it is truly all text. The question for possible answers. Pay attention to words that are asking you to prioritize or show some level of critical thinking. What would you do first? What's the best answer? What's the most frequent occurrence? Things like that, that will help you understand the intent of where that question wants you to go. And the answer that you choose needs to be the solution to the problem. So for instance, if you've got a patient who is having a blood transfusion reaction, and you got your 4 options, and one of them is to call for help. And I think all of us have been in that position where we're going, I am up to my neck in alligators, I need some help. Is calling for help going to stop the blood transfusion reaction? No. What is going to stop the blood transfusion reaction? Stopping the blood. So if that's the only thing that I can help you understand tonight, it's not necessarily what you personally would do, it's what does this patient need? And there is one best answer. Okay, some common test taking errors. I'm reading into the STEM, adding things. Everything you need to know is included in the STEM, so you don't need to add anything. My nurses who have a lot of experience tend to overthink the question, and they'll start adding things. How much does the patient weigh? How old are they? What's their gender? If that information isn't required, it's not going to be in the question. So please, if you find yourself adding things to the question, stop, go back, read the question. What is it asking you? Taking too much time per question. And again, we talked about a minute per question. If you get stuck, and there'll be questions you don't know the answer to, and that's the reality. Give it your best shot, answer, move on. Any question that you leave blank will be marked against you. So make sure that you answer the question, even if you're truly not sure what the correct answer is. Missing those critical thinking prompts. Changing a lot of answers. Now, I never tell people never change an answer, but if when you're doing your practice exams, you're waffling back and forth between 2 answers, or you go back and you change, and you just answer it, and you can mark it on the exam and go back and check it again. But typically, if you're not sure about a question's answer when you're doing your practice exams, it's a knowledge deficit. And it's a really good opportunity to say, you know what, I need to go back and read up about nerves and positioning. And again, expecting the same questions on the exam that were on any kind of practice tests or flashcards or our study guide. They're not going to be the same. Especially if we're not sure of the answer, we'll tend to go back to our previous experience. And for some of us, that previous experience was a long time ago. What we learned in our nursing programs and in our first years of practice, things have changed. Let me give you an example. When I first started working in the OR, we admitted our patients the night before. Those were the good old days. You did your pre-op teaching, which was fabulous. We also shaved our patients the night before, which we now know is no longer considered best practice. If I answered a question about skin prep, based on what I learned then, I would miss that question. That's one of the reasons why I highly recommend people get that most current information so that you are able to answer the questions based on what's considered best practice right now. For a variety of reasons, your facility may not be able to conform to the letter to our guidelines. And that's, you know what, that's the reality, but that does not absolve us from knowing what best practice is. I know that right now with COVID, a lot of places are reusing their masks. You're using them for the whole day. They're being disinfected and you're using them again. That PPE shortage is a reality, but it certainly is not best practice. So there won't be anything on the exam that talks about critical use of our resources during situations that we're going through right now. This is my favorite one. I still have people tell this when I ask them, well, how did you pick the right answer? If I didn't know, I picked B, or I picked the longest option, or I picked the shortest option, or I picked the option where the word was repeated from the stem. The people who write our questions, who are again your peers, spend a lot of time making sure that all the options are about the same length and number of words, that we're not repeating words, that we're not providing people with some kind of gimmick or trick to get to an answer other than by knowing what the correct answer is. You are holding people's lives in your hands. So this isn't a game. We really want people to be able to demonstrate the knowledge that relates to best practice in caring for our patients. Okay, we're going to do some practice questions now. And I'm going to pull a poll up, and I'm going to let you, basically you're going to be voting. I'm going to time you the first one for a minute so that you can see how long that minute feels. And I think all of you will come away feeling relieved that a minute is typically plenty of time. I'd like you to think about, for these practice questions and then for any other practice questions that you're doing while you're studying, what did you need to know to answer this question? What was the question asking you? If you didn't know what this question was about, you weren't familiar with that type of procedure, that anatomical marking, that nerve, whatever it was, where would you go to find out more information? And then this is one of my most useful things that I talk about tonight, is why were the other options incorrect? We've got 4 options. If you are drop dead certain that 3 of them are wrong, even if you don't necessarily agree with that last one, it's the only one that's left. It's the last man standing. I just finished taking a certification exam in December, and I had to do that for one of the questions. And I went through and I could definitively eliminate 3, even though I couldn't guarantee that I knew what the right answer was. It was that there was only 1 left. So if you get in a bind, get stuck, I wouldn't recommend doing that for every question, but that's one of the things to look at. You can also use this for a study aid for your flashcards. If you're using flashcards, is to look at why those other 3 options are incorrect. You may have to do some extra reading, but that gives you a little bit more bang for the buck than just 1 question, 1 answer. Now you've got 1 question, 4 answers that you know about. Okay, so I'm going to go ahead and start the poll, and we're looking at eye surgery, and we're looking at the patient population which accounts for the greatest number of eye muscle procedures. So I'm going to go ahead and launch this, and you should be able to vote. And I'm timing you. You've got about 20 seconds left. Okay, that's a minute. I'm going to close the poll. Let's see what our results are, and you should be able to see. We've got 57% chose pediatric. We've got 14% who chose both adolescent or adult, and well, I guess they're split equally then between adolescent, adult, and geriatric. Okay. Let's see what the answer is. The answer is pediatric. Okay. What does this show us? It shows me that some people don't do eyes. And that's a reality. Eyes was probably my least favorite specialty, but maybe I would need to go in and do eyes for a week and brush up on that. That can be one option for learning. I could read about it in Alexander's ovarian cones. I could look at, was my brain working so fast? And this probably happened to some of you. You saw eye procedure, you saw age specific groups, you thought cataract, and you marked geriatric. Okay? Sometimes our brains are not our friends, and they work too fast, and they just pick up bits and pieces of that question. So make sure you're reading the entire question and you understand that it is talking about eye muscle procedures that we want to fix early in these little kidlets' experience so that they don't think the world looks this way. For all of our practice questions, we provide the rationale and the reference. If you are purchasing other companies' study materials, and that's certainly your prerogative, make sure though that you're looking to see that the references are up to date, and it's really nice if they provide a rationale as well. Okay, so that's our first question. You guys did great. I think that you learned something about yourselves, that you certainly learned how to look at a multiple choice question. So let's do another one. Okay, this is how do we evaluate somebody's understanding of their surgery? And I'm going to go ahead and launch that poll. And let you vote. And you've got 10 seconds left. So if you haven't voted yet, give it your best shot. Okay, I'm closing the poll. Let's see what we got. 88% said have the patient describe the procedure in her own words. And 13% said witness her signing her consent form. Okay, so let's think about this a little bit. What does a consent form provide? What does that mean? It means that a patient has been explained the risks, benefits, and alternatives to a procedure. Informed consent. Okay. Doing a teach back is the best way we have to know that the patient understands what's happening or what's going to happen. Okay. Again, this is from Berry and Cones. Doesn't mean that Berry and Cones is the best reference. It's just they do a really nice job with patient education. And again, there's our rationale and our reference. So if you were unsure about the answer to this question, you may want to look at patient education and informed consent. So that gives you a little bit broader base of knowledge for other questions. Okay, good job. Last question, got a missing sponge. What is our first action? So let me pull that up. Let you think about that for a minute. What are we going to do first? You've got about 15 seconds left. Okay. Here's our results. And this is not unusual to have people split almost 50-50 between repeating the count, notifying the surgeon, and then we've got 10% who said notify the supervisor. Now again, look at what this question is asking you to do. You have got a missing sponge. Which one of these options is going to fix the problem? Okay, I want you to think about that. For the people who chose repeat the count, I think this is a natural response. It's something that I would probably think of early in my problem solving. You kind of automatically think, well, I missed something. I miscounted something. It's, got kicked under the bed. It got thrown in the trash by mistake. I've got 2 lap sponges, you know, wadded together in my count bag. So I'm going to go through and make sure that I'm right and there really is an incorrect count before I tell the surgeon. What is the surgeon continuing to do while I'm doing all these things? They're continuing to close. And if the incision is closed, even if the patient has not left the room, Joint Commission considers that a sentinel event. Okay, and we don't want to have sentinel events, but we also don't want to harm our patients. So the correct answer is to notify the surgeon. Okay, we have to tell them, I've got a sponge missing, I need you to re-explore that wound, and I'm going to look everywhere else. And I get that there might be some resistance there, but you need to get verbal affirmation that they have heard you. That's going to help resolve a retained foreign item. Okay. AOR guidelines has a whole chapter on this, and that's I pulled the 2021 reference from that. There's the page number. So this is the resource, one of the primary resources for getting more information about this. So yeah, you got a little taste for how to analyze a multiple choice question, and hopefully you know more than you did at 5 o'clock. Okay, let's look at the application process. This is what you will see when you go to our website. And we've already talked about eligibility, talked about a good time to take the exam. Let's look at the application process. First of all, you'll need to set up a CCI account, and you'll use an email address, and you'll develop a password, and then that gives you access to all kinds of resources as well as the application for the CNOR exam. You're going to need some information, and if you've got this handy when you get ready to apply, it takes truly 10 minutes. Doesn't take very long at all. You will, I should back up a little bit. You will get an email that says when your application has been approved, and it will give you information then on how to contact our testing partner to set up your testing date. We are required by our accrediting body, just like you're accredited by Joint Commission, we're accredited by a couple of different certification organizations to audit a certain percentage of people who apply for the exam. This helps us maintain the integrity of the exam and make sure that people are not applying for the exam who are not eligible. So if you're audited, what you're doing is helping us maintain the integrity of our exam and meet our accreditation standards. So help us with that. You may be asked to provide verification of employment. We may be contacting your employer for that information to make sure that you're currently employed and or that you have the required amount of experience in terms of years. We can verify your license through nurses, so that's something else we may be doing. If there's any information that's not provided, it's your responsibility to make sure that we do get that. And then we'll send you an email when you've completed your audit and when you'll be able then to apply for your exam. An application fee for an individual test is $395. Please, please, please check our website. If you aren't going to test until later on in the year, I can't predict that prices are going to go up, but they could, so make sure that you have the most current information. What happens is you will apply and pay 1 month, and then you will have a 3-month testing window after that. So once your paid application is approved, you're going to schedule your testing date through your CCI account So for instance, if you apply in January, you would be able to pick a date in February, March, or April in which to test. So look at your life for the next however many months. If people are getting married, having a major operation, changing jobs, some of those things can get in the way of studying. So look at your life and be realistic. Is this a good time to prepare for the exam? We have a new testing partner. We just started working with them January 1st of this year. Same exam, same screening principles. One of the nice things about our new partner is they have more testing centers, more availability. So that's a good thing about our new partnership. If you applied last year and asked for a January or February testing date, you'll automatically be transferred then to the PSI website. So that's the way that works. We also have remote proctoring available, which means that you take the exam from your home. Now, before you get all excited, please understand that your computer and your internet have to support an exam. So when you schedule your exam, look at those requirements. Again, I took a test in December and I was all excited about remote proctoring. And then I looked at the requirements. My home did not provide me with what they would consider to be a secure setting. I've got bookcases everywhere. I would have had to have, moved things around, basically remodeled my home so that they would know that I didn't have access to references while I'm taking the exam, that kind of thing. If your internet's a little bit spotty and you're afraid that you might get cut off from the exam for whatever reason, sometimes it's easier just to go to the test center and take the test, and you don't have to worry about any of that. But truly, it's up to you. It's your choice, and it's nice to have a choice between an in-person testing experience and a remote proctoring experience. Pros and cons for both. How do I schedule a remote proctored exam? First of all, you'll need to meet your eligibility requirements. Your CCI account is created. You need to apply to test. Make sure, again, that your computer's compatible and is able to download the software to take the exam. And then run a systems check when you're scheduling to make sure that you're going to be able to test from home. You don't want this to be another stressor. We have a Take Two program that is something that I just want to throw out there for you, where it gives you 2 opportunities to test for 1 price. We have 2 options, facilities or individual, and there's a separate application process for both. For our facilities Take Two program, there needs to be a minimum of 5 people who are signed up to test. You don't all have to test on the same day, but you all have to apply at the same time. And your facility then will pay the fee, and they're paying $395 per person. If you sign up for an individual Take Two, it's $445. And you have the opportunity to take 2 takes in a 12-month period. If you pass the first time, unfortunately, you don't get any money back. But it gives people sometimes that little buffer, that little security, sense of security, that I could test again if I needed to, and it's already paid for. Please understand that statistically, your first test attempt is you get the best score. So please don't think that you can just use your first test experience as a practice. Make sure that you're taking it seriously, that you go in whatever version you use, that you're going in best prepared. But your facility may have a Take Two contract with us and you don't even know it. So check with your manager first. I know that you are focused on passing this exam, and that's where you need to be right now, but I need to talk to you just a little bit about recertification, because we've made several changes in the last couple of years, and your mentors, your educator, your supervisor may have been certified for a long time, and they're used to some things that are no longer available options for you. Number one, you cannot recertify using the exam. That option went away January 1st. Your option to recertify is the points method. You are no longer able to recertify using contact hours alone. You need to have 300 points to recertify, and there are tons and tons and tons of options. And you don't need to spend a lot of time on this right now, but just know this is your recertification option, and anything that you do this year, if you become certified in 2021, you can use anything during this year to recertify. And we'll look at the accrual windows here in a minute. All of the options are capped except for academic study. So if you're going back to school, or you've gone, or you will be going to school in the next 4 or 5 years, you can use those classes to recertify. Make sure that you save the evidence, and that is outlined in our handbook. If you say that you taught a class, but you don't have any evidence of that, and you're audited, there's a chance that you could lose your certification. So make sure that with the points method, you're working forward and you're saving stuff, so that if you are audited, you're able to provide that information. So let's look at accrual windows. Boy, in 2021, it just doesn't seem possible. But here we are. You're going to certify this year. Your accrual period for your activities is January 1st of this year through December 31st of 2025. Your recertification year then is 2026. If you recertify before July 1st, you get a discount, but your credential is valid until December 31st of 2026. So that most of my folks on the call tonight are probably looking at certifying this year, and there's your accrual window and when you need to recertify. Okay, again, I'm recording you this webinar, and it will be available on YouTube. Please give me a couple days to get this recording to our marketing folks for them to put this on YouTube. We do a lot of webinars. Obviously, the one we're doing tonight is CNOR certification, and we're doing one next week on CNOR recertification. These are always held at 5 p.m. Mountain Time. And then we've got multiple other certifications. We've got our ambulatory surgery certification, our surgical services managers certification, and then our clinical nurse specialist advanced practice certification. So there's obviously a lot of choices here. CNOR may not be the one that has the most meaning for you, so you've got lots of options. Here's our contact information. I'm going to come back in and see what other questions we've got. Okay. Yeah, multiple choice questions. You know, there's the science behind writing multiple choice questions. People, especially whose English is not their first language, really struggle with multiple choice questions. By the time they wade through what it is they're being asked to do, they've forgotten what the question was about. So that's why we don't use those types of questions. Even though if you answer the little questions in AORN journal articles, they'll use that format. We don't use that format. Pass rate, thank you. You guys are asking great questions. Pass rate for first-time CNOR exam takers, it vacillates between about 68 and 72%. So that's what we see. What edition is newest for flashcards? We no longer offer flashcards. I know that other companies offer them. Again, see if you can't look at a sample. Make sure that they are using credible references. We've seen some problems with companies that don't use good, don't have a rationale, don't have current references, or don't have references at all. So make sure that you're looking at products and that they are quality products before you purchase them. PSI is the company that is our new testing partner. Our Arthur testing partner, Prometric, we no longer are using. So any references to Prometric, or if we tested with Prometric before, PSI is our new partner. Proctored exam is basically you are testing at home and you have somebody who is observing you at home, just like there's somebody observing you if you went to a testing center. So it's the same thing. There are, if you go to PSI's website and go to their FAQ page, they have videos that explain both experiences. So I welcome you going and getting some more information from their website. And boy, I've got somebody who's already looking for points. And they're asking, is case review for surgical site infections can be used for points? Look and see what activities we have and how that can could accommodate some of your work experience. So that's the best answer I can give you for that. Look at those activities and see if what you're doing can be used for points. And we add things all the time. So what I'm telling you now, we could have extra activities available in June or July. Okay, and is it really 6 o'clock? I bet some people have some pretty hungry pets and family members right now. So I'm gonna hold on for just a minute or two more and see if we have any more questions. But for those of you who have to leave, thank you. Thank you for your attention. Thank you for your great questions. Thank you for participating in the practice questions. Hopefully I gave you some good information to think about moving forward in designing your study plan. And if you've got any questions at all, don't hesitate to contact us. I'd rather have you ask a question rather than try to figure things out by yourself and spend precious time when we could get you to the right answer in a couple minutes. All right, I'm gonna close it out for tonight. Thanks for your attention. I enjoyed spending this time with you. Have a good rest of your evening. Please stay safe.